please come on in and take a seat right in front of me? Yes. I am Dr. Luna. I am the optometrist and eye surgeon here at Dream Eye Sleep Clinic. And to double check your appointment and scheduling, could I get your name and first and last name spelled? Thank you. So that is with an I. Very beautiful name. Could I get your birthday? Okay. And is your home residence the same as prior, or do I need to change addresses? Okay, thank you. And today it looks like we're here for a very detailed look into your eye for possible signs of allergens and or a glaucoma screening. Yeah. So, looking at my paperwork here. The last time you were in was quite a while ago, so I'm going to make sure to be very thorough, okay? Yes. Just going to get a bit up close to you. I'm going to use some hand sanitizer. May I touch your face? Okay. I also hope the rain didn't bother you coming on in. It's a bit soothing, but... Okay. So, I'm just going to get a bit up close to your eyes, okay? And has your prescription or eye and vision, has it changed since the last time I saw you? Okay. Look to the left. Look to the right. Look to the left and look to the right. Could you look up for me? And look down. Okay. Very good. Sit still. Going to add some dilation drops into your eyes. But first I always add a anti-pain drop. Look up for me, darling. I'm just going to take the eye down. I'm going to drop this right into your eyes, okay? Okay. Other eye. Very carefully. Okay. I'm going to quickly pat your eyes to the cotton wipe. So just going to pat very carefully. Okay, does that bother your eyes at all? Nope. Okay, blink for me. Thank you. So, gonna get a glove on really quickly. Doing okay? The sound of rain always soothes me, so if that can help you relax, I hope it does. So, just going to carefully just get pretty close to your eyes. Okay, I'm gonna touch around your eyes very carefully, first starting with the left. Keep your eyes open and looking at me. Okay, any pain or sensitivity? Okay, other eye. And any pain or sensitivity? Very good. I'm now going to turn the light directly at you. It's going to make me a bit of a different shade, but I'm going to be just quickly taking a glance right Are you having any difficulties identifying my face in the dark? Okay. We're going to perform a pen light exam first in the dark, then the light. First looking at your left eye. Okay, any pain or sensitivity? Okay. Double vision at all? No. To the right eye. Look at me. Okay. And then back and forth. Okay, very interesting. I'm going to turn that off now. Now I'm just going to turn the light back on to see if your eyes dilate properly. Okay. And does that hurt your eyes at all that I turn the light back on? Okay. Keep looking at me. I'm gonna grab my glasses again. Just going to look. So eye dilation appears to be neutral, no change. Now that I also turn the light back on, are your eyes experiencing any double vision, blurriness? Okay. Good to know. Okay. I'm gonna add the dilation drops into your eyes now. Okay. Please look up for me. We're gonna do a glaucoma test after this and then bring the light back out. So look up. 1, 2. Very good. Other eye. Now. 1, 2. Very good. Now blink. The solution is a bit more, I will say it's a bit more of a firm solution. I'm going to grab a soft silk to wipe your eyes because this solution's a bit more firm. Just going to pat like this. Okay. And the other. Okay, blink for me. Thank you. Gonna do a glaucoma test now. I have a pen here, and it's going to blow air right at the tip of the pen. I'm going to push it onto your eye. You won't feel it, as I've already put anti-pain drops in your eye, which numb the eye, and the dilation drops. And I want you to let me know if you feel the air blowing into your eye. You shouldn't feel pain, just a slight pressure change, okay? So I'm just going to poke this right into the eye. It's not going to hurt. I just want you to let me know if you feel the air. So I'm going to do the button in 3, 2, 1. Anything? Okay. On to the other eye. 3, 2, 1. Very good. I'm going to test the inner corner of the eye now. So 3, 2, 1. Anything? Very good. Other side. 3, 2, 1. Very good. Okay. So eye sensitivity working at very low pressures. Glaucoma can be found in the eye if your eye doesn't react, because there will be a problem with your eye feeling pressure and sensitivity. You appear to be functioning very good with your eyes, so good to note. I'm going to pull the pen light out again. Keep looking at me, okay? Just keep looking at me. I'm just going to shine this just a bit into this left eye again. Look at my nose or look at my eyes. Now, if you could please look at the pen light direction. To the left, down, up, right, left, down. And are you feeling any sensitivity or pressures towards that at all? Okay. Any double vision? How many fingers am I holding up? No. No. Good. This side. Looking at your right eye here. Look at me. Look at my nose or my eyes. Okay. And again. Dilation's working properly. And I'm going to take a little bit of a peek closer, particularly to this eye. And that's just because I'm going to look deep into your pupils. So, not noticing a difference with that. I'm going to quickly pull up a magnifying lens to this one. I'm going to just take a quick look right into the eye. And I'm seeing that the inside of your eye is looking proper. Let's look at this one now. Okay, and same with this one. So, this one's looking mighty good. Okay, the health of your eyes are looking good. Back to this one. Look up. Look down. Follow it. Look to your right. Look to the left. Okay. Very good. We're going to add, it's like an eye cream, I would say. You are experiencing redness and irritation around the eye, and this clinical formula will actually conceal the redness, helping me see into your eye without being distracted. So, what I'm going to do very quickly, let's just get a Q-tip. And this product's a bit funny. It smells like roses. You just apply a bit onto the back of the hand, like so. Take a bit of a cotton round here. I'm just going to apply it carefully to the eye. It is going to go into your eye a bit, might blur your vision, so just be careful with this. Yeah, it is a bit blurry, I noticed. Done it myself, but it's a gentle eye cleanser and will also conceal redness around the eye, preventing me from focusing on that. So I'm just going to cleanse that a bit. Very good. Is your vision still a bit blurry? And are you noticing that colors are popping a bit more, as in lights are a bit more reflective? Perfect, that should be happening. That means the medicine is working with the cream. And I'm just going to carefully take just a quick look at that. Just going to take a quick look there. Okay, and a bit more. How's your vision looking now? Perfect. I'm going to go into a bit of an up close look here with the lenses, and I'm going to see if your prescription has changed, okay? Good. I'm going to ask you just a couple of simple questions, and as always, the lenses are a bit foggy. Gonna grab a cleanser here, and just going to wipe that down. Okay, here's our lens. Look at me. A bit bizarre of a question, but I want you to let me know if the image is more or less distorted when I show you the lens, okay? So, I'm just going to put the lens right here in front of your eyes. And is the image distorted? Yes. And how is this distortion working? by widening your frame. Perfect. And if I take a look here to the left and to the right, copy me really quick. Turn your head left and right. Marvelous. Any double vision? Okay, how many fingers am I holding up? Good. Gonna flip the lens again. You let me know how your vision is distorted or non-distorted. Okay, so it has sucked the image into an opposite direction, which is also to be happening. How many fingers am I holding up? And now? 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 Perfect. Okay. And what was easier to see? This was the first. Okay. And this is the second. Which one's easier to see? The second. Okay. Very good. I'm going to tilt the lens this direction. I'm going to ask you a different question now. I want you to tell me if my face becomes more detailed, less detailed, or there's no difference. There will also be distortion in the image, but look for the details, okay? Good. So, I'm going to put this right in front of your eye. More or less detailed or the same? Okay, very good. And flipping the lens. More or less detailed or the same? Okay. So it appears that this prescription that we had prior for you is not working anymore. So that was your prior lens that I was testing. I'm going to just move it up by 0.25 because the prior one was just not cutting it close. So, moving on to the second lens, I'm just going to show you these. So, this is a stronger lens that I have right here, and this is the weaker lens. You can tell more light reflects off of the stronger lens than the weaker one. I'm just going to quickly put these close to your eyes. Okay, and opposite direction. Okay. I wanted to see if your eyes are going to react to the stronger lens. Now grabbing my lens cleaner, I'm going to clean the stronger one and are just going to test your eyes again, okay? Good. So, this lens has a bit of lines on it as it's been used for many, many, many years now. But you should still be able to see. So, I'm going to ask you, is it better or worse than prior? And what is the distortion you see? I do put the lens right here. Okay, it's a wider distortion than prior. How many fingers am I holding up? And now? Great. Gonna flip it around ever so carefully. Okay, how many fingers am I holding up? And how did this one distort the image? Very good. I'm going to turn the lens this direction. I want you to tell me if the image becomes clearer or less clear. So, clearer than prior without the lens, or less clear? Very good. And I'm going to hold up this one again. Clearer or less clear? Very good. So, I'm going to show you the prior lens that you had. I'm going to ask you the same question. Is this better? Or is this better? Okay. So it looks like 2 is what we're going to go with now, the stronger prescription. Also, the lenses tend to be a bit blurry when they get so close to your eyes, but normal glasses are too. So, just going to check there. So, we're going to up your prescription a bit, and we're also noticing that the outside portion of the lens is shortening the vision, so we're going to give you an extended lens. Okay. Next, we're going to do a quick color assessment test. Got a couple of things here. And I'm going to ask you what color you see, okay? So, can you identify this color? Follow it with your eyes. Keep following. Okay, what color is this? Okay, I'm gonna put it at the back of my hand. Does it change the color? Nope. And what color is this? Orange, very good. Pulling up the next, follow the cotton tip. What color is the lens? What color is the cotton tip? Okay, here. What color is it? Follow it, follow it, follow it. Blue, very good. I'm gonna go on to this one now. Follow the cotton tip. Follow it with your eyes. Follow, follow, follow. And what color is it? There's it at the back of my hand. Green, very good. Last one, a bit tricky. Follow this. Any idea what color this is? I'm gonna put it at the back of my hand here. Okay, I'm gonna get a bit closer as you might be a bit prone to a color deficiency with your eyes. If this color is unable to be seen. Okay, well this is a light pink. I'm gonna note that there could be color deficiency in your future. And we're gonna do it now. Because of that result, that means red could be a problem, so we're going to do something called a red concentration test. And it's also just a way to tell me if you're having problems seeing red. And concentration of red in this is very strong. Follow this, what I have in my hand. And are you able to see that red is a constant color when I pull through your eyes left and right? Focus, 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 focus on it. Just focus. And is red pulling as a constant color for you? Okay. So that means that lighter colors could be something that I'm going to have to look at for the future. You had no problem identifying the orange, the green, and the blue, and red, but light pink. I'm going to write that down. Have you had any headaches recently? Because sometimes color problems can come from stress and tension on the head. Okay. Thank you for letting me know. And last but not least, I'm going to quickly reapply an ointment to the corners of the eyes. So I'm going to grab a fresh cotton tip here and I'm going to get just a bit of ointment there. I'm just going to apply that to the corners of the eyes. So just right there, bit, right there. Okay, right there, and right there. Okay, And it looks like your eyes are very prone to having a lot of tension on them. So I'm gonna give you some sunglasses before you leave out of here. Are you feeling okay at all? Good. Any vertigo, double vision, blurry vision, field blur behind me? No. Okay. So it's good to go. I'm gonna just finish off writing your prescription. I'm gonna send it up to the front desk, and I'm going to resubmit a new prescription form for you so you can get glasses and contacts and whatever you need, okay? Perfect. I hope you have a good day. Don't get too cold outside. I know it's raining. And have an amazing evening and night. Let me quickly give you your paperwork here. Here's the papers. Good. And I hope you have a good rest of your evening. Take care of your eyes. Okay?